empathy is a big reason for people pursuing medicine, but it's not ever interrogated, as a primary point of entry to medical school currently.
Yeah.
And what it is retrieval and recall and ability to really memorize and recall. And to your point, when now I can use this, is if the literature shows that an AI augmented physician is superior to a physician alone, there'll be this day to where not augmenting is, a little bit reckless or half-assed, right? Where you're like, wait, you don't use AI at all, like 10 years from now, right? So when you have that concept, now there's this whole discussion of what should be the role of, or the assessment of a person applying to medical school. Like, is it their configurability? Is it their adaptiveness? Is it their able to prompt engineer, which takes some, degree of linguistic, prominence and appreciation. I was a philosophy undergrad, and everyone was like, why are you wasting your time? And I was like now I can kind of laugh about it because and say, aha, because it's very relevant. And then the second piece is the empathy. I got to give a shout out. I've never talked about a movie before, but everyone's, talking about this Subservience Megan Fox movie with an AI robot, which did a decent job. But the one that really blew me away was Ex Machina. And it's much older. It's actually in 2014. And it actually got into an internal debate in our household about like, well, but it was taught to have emotion. I'm like, look, you can't be taught to have emotion like today. But what you can do is be very effective at knowing what emotion elicits. And it did a great job of being able to, the premise is that basically all the all the cameras on phones and computers, the company that powered the actual video transmission was using AI and machine learning to see what reactions got what. A bad, show, a bad news article, something that was exciting, something that was frivolous, and learned every single microfacial reaction, and the words and the context and everything else, and to where it just got to learn really well. And I'm not going to spoil it, but I think that's a good example, not one to turn away. I mean, if anything, I think anything that's good and productive for someone's emotional health, psychological health, I know you feel the same way, which all has data on outcome anyway, like at least in cancer, and I'm sure cardiovascularly, like, just learn and be humble about a lot of things.
Yeah. First of all, I love that movie. And I thought it was really good. I do feel sometimes we're living in a sci-fi world all of a sudden, right? I think for years we would grow up like watching these movies where you talk to computers and they talk back to you in a very lifelike way, even thinking about humanoid robots. Suddenly we're in that world. People are making robots that move like humans. That look
Avatars.
Like humans.
There are people falling in love with these avatars that are talking to them on their Vision Pros and stuff because they're just so good.
Yeah. We're suddenly in that world, and I think they have to be wary of the fact that we're moving so fast that we really do need to pause and think about its implication. I think your comment about entry to medical school is a really good one. I mean, we still have the criteria and the approach to medical school admissions that we had like 100 years ago, or where I come from, 300 years ago or 500 years ago. It really hasn't changed. It's focused on how well can you do chemistry? How well did you do in your physics exam? And this is nothing to do. And it's never been predictive of anything. And yet those are the criteria that we use for admission. And we do this. And that's also, remember, it's not even just medical school for people who are going to sit and spend time talking with people and thinking through diagnostics. It's also surgeons who are going to spend, a very significant portion of their time working with their hands. And yet we don't look at hand-eye coordination and your ability to tie knots, or if we said that fighter pilots were going to have to go study chemistry or something similar, or even some basic fundamental element of physics for engineering, and then we were going to decide who the main fighter pilot was, you'd say, well, that's insane. Or if you were going to choose the best NBA basketball player based on some test, you'd say some academic test, you'd say that's just wrong. But we still do that. We still torture our high schoolers with chemistry rather than, thinking about who has the skill and talent to operate in the world they're going to be in, which is this one where these language models will be available to everyone, patients and doctors. And the doctor who doesn't know how to use the language model and the AI and doesn't use it to be a better doctor is going to be a less good doctor as a result.
Right.
And so I think it's a really interesting and important point that
and they're getting out in 7 years, like at the earliest.
Right.
right? 4 plus 3 is the earliest. And so it's like, what world are they going to be in? Like, if one argues that physics is important because it teaches you kind of problem solving, I love it. Fine. I can roll with that. But
Mhm.
we know AI can do problem solving. Take all the multimodal considerations when it comes to, especially like at least with cancer, the digital pathology, the radiology, the polymorphisms and all this stuff. And then compare it to real world data or evidence that you can't even possibly query for every, cancer type and demographic and nuance.